Did you know that around 50 million people worldwide have epilepsy, making it one of the most common neurological diseases globally? Huh. This is Teacher Akila, and today we are going to learn about seizure disorder and epilepsy. Before we go deeper, let's look at the overview of today's lesson. So, at the end of this presentation, you should be able to define the seizure disorder and epilepsy, type of seizure, sign and symptom, diagnosis, and the treatment of epilepsy. Now let's look at the meaning of seizure disorder. Basically, seizure disorder, often referred to simply as seizure, are a neurological event characterized by a sudden abnormal electrical activity in brain. This electrical disruption can result in a wide array of symptoms and manifestations. It's also temporary involuntary change of consciousness, behavior, motor activity, sensation, or automatic functioning. So, epilepsy is one of the type of seizure disorder. So, epilepsy is defined by the presence of recurrent seizure, typically more than one. This seizure can vary in frequent from multiple episodes daily to much less often. There are diverse range of factors that can lead to seizure disorder. First, idiopathic epilepsy. Idiopathic epilepsy refers to cases where exact cause of seizure remain unknown. It is often has a genetic component and may be related to subtle brain abnormalities that are difficult to detect through the current diagnosis method. Second, symptomatic epilepsy. Symptomatic epilepsy, on the other hand, occur when seizures have an identifiable underlying cause. This may include brain injuries, structural abnormalities, or other medical conditions. Third, genetics play a significant role in some cases of seizure disorder. Individuals with a family history of epilepsy have an increased risk. Certain genes are associated with a higher likelihood of experiencing seizure. Next, infection affecting the brain such as meningitis can lead to seizure. This condition results in inflammation of and damage to brain tissue, which can disrupt normal electrical activity. Lastly, developmental disorder, particularly those impacting brain development, can contribute to seizure disorder. Conditions like structural brain abnormalities present from birth can make certain brain regions are more likely to seizure. To conclude, seizure disorders are a complex neurological condition with a variety of potential causes. Identifying the underlying cause is crucial for determining the main appropriate treatment and management strategies. There are two types of seizure and has their own significance in the context of epilepsy. The first one is focal onset seizure, or we call it as partial seizure. This seizure originated in a specific area of the brain, often causing distinct symptoms. They can be further categorized into two subtypes, which are simple partial seizure and complex partial seizure. Next is generalized onset seizure. This seizure involves both brain hemispheres from the onset and encompass a range of subtypes, which are absent seizure, tonic-clonic seizure, myoclonic seizure, atonic seizure. Now let's look at the generalized seizure. Since there are four subtypes of generalized seizures, let's look at the tonic-clonic seizure first. Tonic-clonic seizure is the most well-known type of generalized seizure. They are typically involved in two phases, which are tonic phase and clonic phase. The tonic phase is categorized by muscle shifting. During this phase, the person's body becomes rigid and they may often emit a cry due to air become forced out of the lung. And the clonic phase follow the tonic phase and involve rhythmic jerking muscle movement. This phase may last for several minutes. Next is absent seizure. Absent seizures, formerly known as petit mal seizure, are characterized by their brief and sudden onset. These seizures lead to a temporary loss of awareness or conscious. During absent seizures, individual may exhibit subtle signs such as staring into space, minor eye blinking, or lip smacking. This person typically remain unresponsive during the episode. Next is atonic seizure. Atonic seizure, also referred to as drop attack, involve a sudden and profound loss of muscle tone. This abrupt loss of muscle control and lead to the person collapse or fall. Atonic seizure can be particularly concerning due to the potential for injury when an even individual loses muscle control and falls. Lastly, myonic seizure. It is known for their sudden brief muscle jerk and twitch. This movement can affect specific body part or manifest as generalized jerks. Myoclonic seizure can have various triggers, including deprivation, medication side effect, or underlying neurological condition. In summary, understanding the range of generalized seizure, including absent, tonic-clonic, myoclonic, and atonic seizure, is essential for accurate diagnosis and effective treatment in individuals with epilepsy. Next, let's look at the focal onset seizure, or we call it as partial seizure. The first one is simple partial seizure. Simple partial seizure are one of the two main categories of focal seizure. The seizure originated in a specific localized area of the brain. What sets simple partial seizure apart is that they typically do not impair consciousness. The person remains aware during the seizure, but they may experience unusual sensation, emotion, or movement. The common example of symptoms during simple partial seizure can be include tingling or numbness in a specific body part, unusual taste or smell, or even subtle twitching or jerking of limbs. Next is complex partial seizure. Complex partial seizure are the other major category of focal onset seizure. These seizures are more intricate and often involve altered, altered consciousness. During complex partial seizure, individual may experience altered consciousness or awareness. This may result in period of confusion or a dreamlike state. A defining feature of complex partial seizure is the presence of repetitive behavior. Individuals may engage in automatic or often purposeless action such as lip smacking, chewing, or hand rubbing. Some of them even experiencing emotional changes, including fear of intense feelings that can also be observed during complex partial seizure. The sign and symptom of seizure can vary widely dependent on the seizure and the area of the brain affected. Some of the signs including altered consciousness, uncontrollable movement, sensory changes, and many more. The diverse range of signs and symptoms associated with seizure disorder highlight the complexity of this condition. Accurate recognition of these manifestations is crucial for effective support and management. Next, let's talk about diagnosis of seizures. So the diagnosis of seizures involve a true medical history, physical and neurological examination, witness account, and various tests such as EEG, brain imaging, and blood tests. Now, let's talk about EEG. One of the primary diagnostic tools is the electroencephalogram, or we call it as EEG. This test records the electrical activity in the brain, and it helps determine the type of seizure and their origin. Next, brain imaging. Imaging techniques such as MRI and CT scan are often employed. These provide detailed image of the brain's structure and can reveal any abnormalities and lesions. Lastly, blood tests. Blood tests may be conducted to rule out other potential causes of seizure, such as metabolic disorder or infections. In summary, the diagnosis of seizure is a multi-step process that involves clinical assessment, diagnostic tests, considering the differential diagnosis, and developing tailored treatment plans. Accurate diagnosis is the cornerstone of effective management. Treating seizure is crucial for people with epilepsy. Now, let's explore the main ways we do this. Doctor often start with medication, and these are likely safety nets for the brain. They help control the electrical activity to prevent seizures. Doctors picks the best medication based on the type of seizure and individual's needs. It's important to take this medication as prescribed. If medication don't work, surgery might be considered. It can involve removing the part of the brain that caused the seizure. Sometimes a special diet like the ketogenic diet helps control the seizures, especially in children. Healthy living, regular sleep, stress management, and avoiding triggers can also make a big difference. Epilepsy often needs ongoing care. Regular checkup with doctors are important to see if the treatment is working. Support from friends and family is just as important. Living with epilepsy can be challenging, so having people to lean on is a big help. In short, treating seizures involve medication, possibly surgeries, lifestyle changes, regular checkups, and the support of loved ones. The goal is not just to stop seizures, but to improve the quality of life for people with epilepsy.